And I will tell you now that this is the first time I've ever met you, but I really like you for one reason.
I'm married well.
Your wife's father was a hero to all of us. I mean, again, a superhero that we just felt like was the greatest thing that ever hit this area when he came here in the late 60s or whatever it was. And then her brother has followed suit. So they have been an absolute pillar in particular cardiovascular here in this city.
I'm married up in a lot of ways. I mean, and we'll break in a second because I do want a chance to nick you and all. But anything else as it pertains to TennCare that specifically that you say, you know, I'd like to get somebody's ear on this?
Well, we probably do about 35% TennCare.
Okay.
In the NICU, or neonatal unit, we're probably at about 45, if not 50% TennCare.
Right.
And our two new plans, I will say, the reimbursement is just a little better.
Really?
It's a little better.
Wow, okay. Good.
You know, we're still not covering costs, but it's still better than it was. But just anything to do with that reimbursement.
Yeah, interesting your numbers, Matt. Statewide, about 25% of the people in the state are TennCare patients, but the healthcare user number is a little higher. It would be almost what yours is statewide in terms of percentage of healthcare dollars.
I think if you really get into it, and a person like you with a business that could, you can reduce the actual waste that's in the program an awful lot.
Yeah.
And one little example that we encounter here occasionally is the so-called Disability Act. Any child that's born that weighs less than 1,200 grams, by definition, is disabled. Now, they could be Mr. Morgan's grandbaby. Suddenly, that baby is eligible for TennCare. In other words, a person can have the best insurance, commercial insurance.
And help me do the math. What's 1,200 grams in pounds?
Well, 1.2 kilograms, it would be about 3 pounds.
Okay. So if you're born under 3 pounds,
2.5 to 3 pounds.
so roughly in there, you're automatically become interesting. Regardless
and we've
of
actually had, we know of situations where HR departments in, even like FedEx, you know, a pilot who has good commercial insurance, suddenly their child, this baby who may be in the nursery under the good NICU people that we have for an extended period of time, and that's expensive.
That's interesting.
But they're on the TennCare tab. So that's just one little thing. That's one little thing. But there are abuses of it that if you get into it and really live into it, I think there can be savings. Mr. Pounds and Mr. Gordon can certainly get into that a lot better than me. I just know these few little instances that we have that bother me.
Well, it's interesting. There are people that live in other states who are on TennCare.
Oh, absolutely.
Which, I mean, you get into some of the pieces, and how does that go? And I know a couple of these people who are very well-to-do, and I think, how do you do this? And I really, the relationship is not one where I want to quiz the person.
Right.
How are you cheating the state of Tennessee? And how are you living in Mississippi and qualifying for TennCare payment? That there's got to be some detective work put forward to get that rooted out. And if that's occurring in this community, it's happening in Chattanooga, it's happening I don't know if it has to do with when you live close to other states like Arkansas and Mississippi, but we've touched Virginia and Georgia.
It'd be a little bit more successful here, susceptible to that here, but still, it's got to happen.
Well, given your time requirements, Anita, you want to give a little bit of overview of the Women's Hospital and then tour us, unless there are other things
that's great. I really appreciate it. I realize Friday afternoon is an incredibly inconvenient time, so thank you very much.
I was really going to just as we walk.
Okay.
But I can tell you
we can do that.
Opened in May of 2001. We're 140 beds. In Dr. Johnson's famous words, we would be a failure if we were just a birthing center, and we're not. We're full service. We do everything except I'll let my brother Jason here do the hearts and neuro and ortho. Otherwise, anything women need, we do it here. So we have a breast center that does 50,000 procedures a
Wow.
year. We've had 4 breast radiologists that do those procedures. And we'll see that in a minute. But we have a 40-bed NICU. Census fluctuates.
I was going to ask, what
they've
is the
been-
population typically?
We usually run about 70-75% occupied.
In
But-
the NICU?
Yes.
And what about in the
NICU.
women's?
It's a lot of it's a Monday through Friday
Yeah.
with deliveries and surgeries, and we're usually at 75
Okay.
to 80%
All right.
in the hospital.
Okay.
We're an insurance-driven community. We're all about safety. We interviewed, we had focus groups with women's groups in our community. Even though it's being designed by a lot of women, we wanted to know their input on what we needed to do, and it came out safety, security, easy access, and one-stop shopping. And I think we were able to do that through a lot of input from our doctors and our clinical staff to design it in a way. We've had very, very few changes since we opened 8 years ago. But on that safety issue, we really developed a good plan. We keep in-house at all times UT, University of Tennessee resident.
Really?
Then you have to have a supervising obstetrician in-house at all times. We keep MD anesthesia and 2 CRNAs in-house and a neonatologist. So we have a great team because I think some folks think childbirth natural. No, childbirth can be very complicated at times, and we must have what we need. And we're having great outcomes since we've been open. We've won the Hessen American Hospital Association citation merit, and I always have to say we won Best Place to Work through a commercial appeal, and have to say we make 600 women happy.
Pretty good.
Something.
That's congratulations. That's a big deal.
But it's because of, I mean, we've got a lovely, beautiful building that was designed, but it's the folks inside. And I've never worked with the medical staff that has been as dedicated and step up to the plate, be champions in quality process. We're striving for perfection. We compare ourselves to Vermont, Oxford, CWISH, a number of different ways to see what are the best practices and what are we doing, and are we meeting those goals. So we're having really good outcomes. And Dr. Conaroo, as we walk through the NICU, will tell you